I want to talk to you today about something subtle that a fair number of older adults notice, often without quite putting words to it, and that's easy to blame on getting older or being a bit unfit, yet that can be a genuine and telling sign of the heart or lungs struggling. Finding that you get short of breath while talking, having to pause for breath mid-sentence, running out of puff on the phone, or finding a long conversation tiring in a way it never used to be, and why this everyday difficulty can carry real meaning. Because getting a little breathless while chatting seems like nothing, easily put down to age or excitement. Yet the fact that talking itself requires steady breath control means that becoming breathless when you talk can be an early and sensitive sign that your breathing reserve has fallen, which can reflect heart or lung problems. So, understanding this is genuinely worthwhile. So, today I want to explain why talking takes breath, what it means when talking leaves you breathless, the heart and lung causes, how to tell a meaningful change from ordinary variation when it matters, and what to do in partnership with your doctor. And I'll keep this calm and practical, because while there are ordinary explanations, a genuine new difficulty talking without getting breathless is a real sign worth recognizing and mentioning, since it can point to treatable heart or lung conditions in partnership with your doctor. This is about recognizing a subtle but genuinely telling sign. Let me start with why talking takes breath, because understanding it frames everything. Here's something we never think about. Talking is a breathing activity. To speak, you take a breath, and then release it in a slow, controlled way across your vocal cords to make sound, pacing it out over a phrase or sentence before taking the next breath. This requires steady breath control and a certain reserve of breathing capacity, and it subtly interrupts your normal breathing rhythm, since you're breathing to speak rather than purely to oxygenate. In someone with plenty of breathing reserve, this is effortless and unnoticed. But in someone whose breathing reserve has fallen, whose heart or lungs are struggling to keep up with oxygen demands, the added demand of controlling the breath for speech can tip them into breathlessness, so they have to break sentences to breathe, can't talk and walk at once, or find sustained talking tiring. So, because talking requires steady breath control and reserve, becoming breathless when you talk can be a sensitive early sign that your breathing reserve has fallen. So, understanding that talking demands breath control and reserve is the foundation. So, talking is a breathing activity needing reserve. So, breathlessness when talking can signal fallen reserve. Let me explain what it means when talking leaves you breathless, because it's the substance. So, what does it mean when talking itself leaves you breathless? It means your breathing reserve has narrowed to the point where even the modest demand of speech exceeds it, which is actually a fairly sensitive indicator, because talking is a low-level demand. So becoming breathless at it suggests your reserve has fallen more than if you only got breathless with vigorous exertion. Practically, this shows up as having to pause for breath in the middle of sentences, being unable to complete a long sentence without a breath, getting breathless or tired during a phone call or sustained conversation, finding you can't talk and walk at the same time without getting puffed, or finding that talking a lot leaves you fatigued. These are all versions of the same thing, breathing reserve too low to comfortably support speech on top of everything else. So, getting breathless when you talk means your breathing reserve has narrowed enough that even speech's modest demand exceeds it, a fairly sensitive sign, showing up as breaking sentences for breath, tiring on the phone, or being unable to talk and walk at once. So, breathlessness when talking is a sensitive sign of low breathing reserve. So, it shows the reserve is narrow. Let me explain the heart and lung causes, because they're central. So, what reduces your breathing reserve enough that talking leaves you breathless? Chiefly heart and lung conditions, which I've discussed. On the heart side, heart failure, as I've discussed, congests the lungs with fluid and reduces the reserve. So, breathlessness that eventually shows even when talking, along with breathlessness on exertion, lying flat at night, and on bending, is part of its picture. And other heart conditions reducing the heart's output can contribute. On the lung side, lung conditions like COPD, which reduces lung capacity, characteristically cause breathlessness, including when talking, often with a cough or wheeze, and other lung problems. Other contributors include anemia, the low blood count reducing oxygen delivery I've discussed, and significant deconditioning. So, breathlessness when talking chiefly reflects heart or lung conditions reducing your breathing reserve, along with anemia or deconditioning. So, it warrants assessment to find the cause. So the causes are chiefly heart conditions like heart failure and lung conditions like COPD, reducing breathing reserve, plus anemia or deconditioning. So it warrants assessment. So heart and lung conditions are the central causes. So it usually reflects the heart or lungs. Let me help you tell a meaningful change from ordinary variation, because that's practical. While some breathlessness with talking can be ordinary, certain features make it meaningful and worth checking. A meaningful change is new or progressive, that you didn't used to get breathless talking and now do, or it's worsening. Out of proportion, breathless talking at rest or with gentle activity, not just while exerting, and accompanied by other symptoms, breathlessness on exertion, lying flat at night, or on bending, ankle swelling, fatigue, cough, or wheeze, which point toward a heart or lung cause. By contrast, ordinary breathlessness with talking is talking while genuinely exerting, like chatting while climbing a steep hill, which is normal. Brief breathlessness from excitement, emotion, laughing, or a temporary illness like a cold, which recovers. Or fitting your known fitness level. So, new or progressive breathlessness talking, especially at rest or with gentle activity and with other heart or lung symptoms, is meaningful and warrants checking, while breathlessness talking during genuine exertion or from excitement or a passing cold is usually ordinary. So the novelty being out of proportion and accompanying symptoms make it meaningful. So read it by its novelty and company. So a new, disproportionate, symptom-accompanied change is meaningful. Let me note that doctors actually recognize this because it validates the sign. Let me note, to reassure you this isn't a fanciful idea, that doctors do genuinely pay attention to this. When assessing breathlessness, a doctor may notice whether you can speak in full sentences or have to break them for breath, since being unable to complete sentences is a recognized marker of the severity of breathlessness. And, in acute situations, breathlessness so severe you can only speak a few words at a time is a sign of a serious problem needing urgent attention. So, the observation that talking is affected by breathlessness is a real clinical marker, not something I'm inventing, which is exactly why you're noticing it in yourself is worth mentioning. So doctors genuinely use whether you can speak in full sentences as a marker of breathlessness severity. So you're noticing talking-related breathlessness is a real, worth mentioning sign. So this is a recognized clinical marker. So you're noticing it is genuinely meaningful. Let me be very clear about the emergency version, because severe breathlessness talking is urgent. Crucially, while the gradual, mild version I've mainly discussed warrants seeing your doctor, a severe version is an emergency. If breathlessness is so severe that you can only speak a few words at a time, or can't complete a short phrase without gasping, especially if it's sudden, or comes with chest pain, bluish lips, severe distress, or the frothy pink phlegm I've discussed, this signals a serious problem, possibly acute severe heart failure, a severe asthma or lung attack, or another emergency needing immediate care. So, treat breathlessness so severe you can only speak a few words at a time, especially if sudden or with chest pain, bluish lips, or severe distress as an emergency, and call emergency services immediately. This is quite different from the gradual, mild difficulty that warrants a doctor's appointment. So, severe breathlessness, allowing only a few words at a time, especially sudden or with chest pain or bluish lips, is a medical emergency needing immediate care. So, severe talking breathlessness is an emergency. So, only a few words breathlessness is urgent. Let me be clear about what to do, because the response should match the severity. So, here's what to do. For breathlessness so severe you can only speak a few words at a time, especially if sudden or with chest pain, bluish lips, or severe distress, call emergency services immediately. For a new or progressive difficulty getting breathless when you talk, breaking sentences for breath, tiring on the phone, or being unable to talk and walk, especially with other symptoms like breathlessness on exertion, lying flat at night or on bending, ankle swelling, fatigue, cough, or wheeze, see your doctor, since together these can point to heart failure, a lung condition, anemia, or another cause worth diagnosing and treating. Describe specifically that talking makes you breathless and how it's changed, since that's useful information. For breathlessness only, while genuinely exerting or from a passing cold, manage it as ordinary, mentioning it if it persists. So, Call emergency services for only a few words breathlessness or with chest pain or bluish lips. See your doctor for new or progressive breathlessness talking with other symptoms. And treat exertion or cold-related breathlessness as ordinary. So, match your response to the severity. So, respond per the severity, urgently when severe. Let me connect this to the wider theme of subtle, honest self-reporting because it's valuable. Let me draw out a valuable lesson, echoing what I've said about small, specific symptoms. Breathlessness when talking is exactly the kind of subtle, easily dismissed change that people don't think to mention, either because it seems too trivial or because they've quietly adjusted, talking less, keeping calls short, avoiding talking while walking without noticing. Yet it's a sensitive, genuinely useful sign. So, the lesson is to notice and report these subtle changes honestly, that you now pause for breath mid-sentence, that phone calls tire you, that you can't chat while walking as you used to. Told to your doctor alongside your other observations, these concrete specifics help build the picture better than a vague sense of being off. So, please don't filter out subtle changes like breathlessness when talking is too trivial to mention. So, the lesson is to notice and honestly report subtle changes like breathlessness when talking, since these concrete specifics help your doctor more than vague reports. So, report subtle changes rather than filtering them out. So, honest self-reporting of subtle signs is valuable. Let me paint you a quick picture of how this helps. Picture a woman in her 70s who's found that she now has to pause for breath in the middle of sentences. That long phone calls with her daughter leave her puffed and tired, and that she can't chat while walking to the shops as she used to. All of which she's quietly put down to age, adjusting by talking less and keeping calls short. Meanwhile, her ankles have been swelling, and she's breathless on the stairs, unconnected in her mind. Understanding that becoming breathless when talking is a sensitive sign that her breathing reserve has fallen and belongs with her ankle swelling and exertional breathlessness, she mentions the whole picture to her doctor rather than just soldiering on. Her doctor recognizes the pattern, assesses her, finds heart failure, and treats it. And as her fluid overload resolves, she can talk in full sentences, enjoy long calls, and chat while walking again. The same woman, but noticing and reporting that talking left her breathless, got heart failure caught and treated, and her conversations back. That contrast is exactly why recognizing this subtle sign matters. Let me speak briefly to those of you caring for an older parent or partner. Understand that getting breathless when talking, pausing for breath mid-sentence, tiring on the phone, or being unable to talk and walk can be a sensitive sign that a loved one's breathing reserve has fallen, reflecting heart or lung conditions, anemia, or deconditioning. You can help by noticing if they've started breaking sentences for breath, keeping calls shorter, or falling quiet when walking, and gently encouraging them to mention it, and any other signs like ankle swelling, exertional breathlessness, cough, or wheeze, to their doctor rather than adjusting around it. Crucially, treat breathlessness so severe they can only speak a few words at a time, especially if sudden or with chest pain, bluish lips, or severe distress, as an emergency and call emergency services immediately. Helping a loved one notice and report this subtle sign can get a treatable heart or lung condition caught. So, let me draw this all together. Getting short of breath while talking, pausing for breath mid-sentence, running out of puff on the phone, or finding conversation tiring in a way it never used to be, can be a genuine and telling sign, because talking is itself a breathing activity requiring steady breath control and reserve. So, becoming breathless at it is a sensitive early indicator that your breathing reserve has fallen. This chiefly reflects heart conditions like heart failure or lung conditions like COPD reducing your reserve, along with anemia or deconditioning. A new or progressive difficulty, especially breathless talking at rest, or with gentle activity and with other heart or lung symptoms, is meaningful and warrants checking, while breathlessness talking during genuine exertion, or from a passing cold, is usually ordinary. Doctors genuinely use the ability to speak in full sentences as a marker of breathlessness. Severity, and breathlessness so severe you can only speak a few words at a time, is an emergency. So, call emergency services for only a few words breathlessness or with chest pain or bluish lips. See your doctor for new or progressive breathlessness talking with other symptoms, and report subtle changes honestly rather than adjusting around them. So, here's what I'll leave you with, straight and clear. First, understand that talking is itself a breathing activity, requiring steady breath control and a reserve of breathing capacity. So, becoming breathless when you talk can be a sensitive early sign that your breathing reserve has fallen. Second, know what it means. Your reserve has narrowed enough that even the modest demand of speech exceeds it, showing up as pausing for breath mid-sentence, being unable to finish long sentences, tiring on the phone, being unable to talk and walk at once, or being fatigued by talking. Third, know the causes, chiefly heart conditions like heart failure congesting the lungs, and lung conditions like COPD reducing capacity, along with anemia and significant deconditioning, so it warrants assessment. Fourth, distinguish a meaningful change, new or progressive, out of proportion, breathless talking at rest or with gentle activity, and accompanied by other symptoms like breathlessness on exertion, lying flat at night, or on bending, ankle swelling, fatigue, cough, or wheeze, from ordinary breathlessness talking during genuine exertion, from excitement, or with a passing cold. And know that doctors genuinely use the ability to speak in full sentences as a marker of breathlessness severity. And fifth, crucially, treat breathlessness so severe you can only speak a few words at a time, especially if sudden or with chest pain, bluish lips, or severe distress as a medical emergency, and call emergency services immediately while seeing your doctor for a new or progressive difficulty getting breathless when you talk, especially with other symptoms, to find and treat the cause, describing specifically how talking affects your breath, and taking the wider lesson to notice and honestly report subtle changes rather than quietly adjusting around them. Getting breathless when you talk is a subtle but genuinely sensitive sign that your breathing reserve has fallen, so recognizing and reporting it rather than blaming age can get a treatable heart or lung condition caught, which is well worth doing. So, take care of yourself. Notice if talking leaves you breathless, report it and any other symptoms to your doctor, and act urgently on only a few words breathlessness. And because getting breathless when talking can be a sensitive sign of heart or lung conditions, reducing your breathing reserve, please treat a new or progressive difficulty getting breathless when you talk, especially with ankle swelling, exertional or positional breathlessness, cough, or wheeze, as your reason to see your own physician and treat breathlessness so severe you can only speak a few words at a time, or with chest pain or bluish lips, as your reason to call emergency services immediately. This touches on breathlessness, which can be frightening, so if you found that talking leaves you short of breath, please know it's worth mentioning to your doctor, who can find the cause and help.